about the second category. This is a newer category, and these are beta-3 agonists. So the bladder has parasympathetic receptors, but it also has sympathetic receptors, and the sympathetic receptors tend to make the bladder quiet down. And so if you take a drug that binds and activates these receptors, it will tend to keep the bladder from contracting. And in my experience, these drugs work pretty well for older folks, because I think as we get older, we tend to get more parasympathetic dominant because our sympathetic nervous system is kind of pooping out. And so these drugs can kind of help offset that effect of aging that many people have. And so Mirabegron, which is brand name Myrbetriq, works this way. Now you got to kind of follow your blood pressure at first when you start this, and if you're taking a blood pressure medicine like metoprolol, then it might not be the best choice. But from a cost standpoint, there's good news in that Myrbetriq just went generic like last September 24. And lo and behold, we have a new version called Gemtesa, is the brand name. And apparently it doesn't cause blood pressure elevation the way a few patients who took Myrbetriq experienced, and it may not interact with other drugs as often as Myrbetriq did. And so that is now available also. Interesting, right? Now, there's a general sense that these are forever drugs. Once you start them, you have to keep taking them for the rest of your life. Not true, actually. If you get serious about a pelvic floor training program like Pilates, practice 5 minutes in the morning, 5 minutes in the evening, there's a good chance you can wean yourself off. So take note. Let me know in the comments below which drug you're taking, or if you have other questions.